Hello, welcome to the Neuroblastoma Parent Global Symposium. My name is Dan from Solving Kids Cancer, and I will be moderating this session. This session is being a teenager or young adult on treatment, which is being delivered by Dr. Louise Soanes. Dr. Louise Soanes is Director of Services at Teenage Cancer Trust. Before I hand over, I'd like to draw your attention to the Q&A button at the bottom of the screen. This is there so that you can submit questions during the session, and we will get those questions answered just at the end. If the button isn't showing for you, then just tap or hover over the Q&A button or the area down at the bottom. If you see a question that you like, you can give it a thumbs up during the session, and that will give us the opportunity to bump it up the order and make sure that that question is given priority. Over to you, Dr. Soanes.
Thank you very much. Can everybody see my screen? Am I sharing my screen still? Oops, sorry. Oh, apologies for that. You can tell it's the first time I've done this. Good morning, and thank you so much for having me. It's been a pleasure to be invited to attend this session. So as Dan said, I'm Louise Soanes. I'm a nurse. I've worked for 30 years with children, teenagers and young adults with cancer. And I'm here today as a sort of independent, although as Dan said, I do currently work for the Teenage Cancer Trust, but this talk is my experience of working with teenagers and young adults. And I've just changed the title slightly because I know a lot of countries use the term adolescence, so I've sort of made it slightly more international. And just a little bit about what I'm going to do today. Hang on, just bear with me. I'm not sure myself. All right, apologies, I seem to have some connectivity. Perfect. Apologies for that, a little bit of connectivity problems. So I'm just going to go through sort of 4 bits of the session, really. How to be a young person, how cancer affects young people, and what healthcare professionals can do to help young people on treatment, and also how we can support the decisions we make. I'd like to thank Kira and her mum, Ord, who have been central to this presentation, and we'll meet Kira on video slightly later into the presentation, and her mum will also appear with her words in the presentation. So let's get going. So we've all been adolescents. Well, some people in the audience might still be adolescents, which is a great thing to be. And we've I've certainly been through young adulthood and probably now into old adulthood. But as we know from what the sort of transitional phases of a teenager are, is that maturing from a child to an adult. And the focus is quite often in our adolescence is about that sort of biological and sexual maturation. But a massive and important part of adolescence, and probably more relevant for this presentation, is how you develop as a person, how you grow, how your identity matures, and how that goes through not only adolescence, but how that building block of developing your identity takes you into young adulthood and across your adulthood as well. The other part, as we all know and probably remember, is part of being a teenager or an adolescent is building relationships with other people outside your family group on a different level. So that also includes relationships of an intimate nature with an appropriate peer. And again, that sense of independence and autonomy as an adult in the context of your social cultural environment, and that transition into moving to part of a group or a community. And those groups and communities may not necessarily just be your new peer group. It can be work, it can be education, it can be your political views, it can be a change into your group or community for your identity or your gender identity, your sexual identity or your gender identity. And then obviously as you move into adulthood, you establish your career, you do those things that we're meant to do as a grown-up, go to work, establish your career, establish a home, learn how to manage it, and possibly, if you choose to, become a parent or rearing children. So for the context of this talk, I'm going to sort of talk about the 3 UK age brackets of teenagers or adolescents and young adults. And that's, for us, is usually taken to be from about 13 to 25. But I recognise if we've got colleagues from America in the audience, then we are talking about people who are up to the age of 40. The other thing that I think is quite often forgotten about when we talk about adolescents and teenagers is how their brain develops. There are some simple things. This is very simple because this is my level of understanding. Parts of the brain that are sort of the emotional side mature possibly slightly before the front part of your brain, with that sort of executive functioning of making decisions and judging risks develops. So that probably leads to some of the sort of adolescent behavior that we take, that we sort of recognize. And quite often an adolescent brain is described like a Ferrari. So an adolescence is like a Ferrari. So you're growing, you're maturing, you've got that emotional drive, you've got that hormone drive. But also, because your brain is slightly behind in that development, your decision making may not be as practiced and as nuanced as it is in adulthood. So people describe adolescence, and I quite like this description, like a Ferrari, but with free brakes. So just bear that in mind, that they don't necessarily behave as we expect them to behave, but that's because it's a very good reason, because their brain is developing. It's not broken, it's just on its way of a different journey. So of course we've got to take this into an individual and cultural variation. There's age, there's the context in which that young person sits in, what their family background is. And particularly for us, I think we've got to think about the influence that health, nutrition, sleep on how people take forward their thinking and how they make decisions, as well as other things like learning disabilities and possibly substance abuse as they try things out in their adolescence and take risks, as this young person is doing here. What we can do to help young people in their decision making and problem solving, or what helps them, is if you're making a decision or you're problem solving, it's the familiarity of the context and the content in which you're making that decision. Is it new? Have they been here before? Have they had a chance to practice? Is there something in their life that they've experienced before that they can draw on the learnings and apply to that situation? Now, that's more likely to be for us as older adults because we've had more experience, we're more settled in our independence, and we're more able to practice that. If you're young, if you're a teenager of 13, or you may not have had much practice in making independent decisions, but that's part of the transition of adolescence. What we know can help is the scaffolding. And what that means is the relationship you have with your parents and your support network that is there to support you, but also will pull back as you grow and mature and allow you to take on more autonomy and more independence, but also come back if situations arise, such as cancer. The other thing that helps is obviously having a family or a social network around you to catch you if you're in trouble, or an advocate as a healthcare professional who can monitor and step in when needed. So what's the impact of cancer on young people? We know that cancer affects everybody in multiple ways. The loss of hair, the change of weight, up or down, the physical signs of scarring, the impact of chemotherapy. Many people in the audience know that very well and lived through that experience. The change of having lines put in has a huge impact on a time of your life when body and appearance is important. And hair loss is important for both men and young women. It's not, I think the conception is it's a female thing, but it's very important for people. How you present yourself is very linked to your identity and to your appearance, and having that altered at a crucial time can have a lot of impact on how young people feel during cancer. I think the other thing, and probably this has been probably heightened during the COVID situation, is the disconnection from peers and friends as a result that can result in isolation and loneliness. As I've said, a part of adolescence is building friendship groups and taking yourself out of that because you've got to go and have cancer treatment. can lead to some disconnection. You become the kid with cancer. Your friends have not experienced this as well, so they don't know how to approach you. They're worried about upsetting you. So they may withdraw and not keep in touch. The normal places where you meet your friends, again, has been impacted by COVID as well. You can't go out and meet pens in groups. You wear masks, everything's different. Things that do help, and we've certainly learned across that in the last few months, is connection through digital. But we know that has its own trials and tribulations, which I'll come up to in a minute. And I think we've all probably suffered Zoom fatigue. If not now, we probably will by the end of my presentation. I think the other thing, particularly for young adults, is that loss of independence and coming back to live with your parents, which can be a positive thing. It can help you, it can give you that support and that network, but it can also be another sort of outward sign that you are different, you're going back to where you've just come from, and also could be difficult for parents as well. You know, part of the normal life is letting your teenager or your young adult move on and disappear, and having that to come back to you has an awful lot of impact on the relationships between both people. And certainly in the young people I've worked with, that can result in some conflict and some challenges as people are moving on. I think the other thing just to pick up is obviously cancer, as you know, affects the whole family. Parents are affected, as I've just described, their child's come back to them, they've got those ongoing relationships with teenagers, and there's normal conflicts which are part of growing up with your mum and dad, and there's differences of opinions happen during cancer as well. Brothers and sisters are impacted. If you're older and you're at uni, do you come back and help your mum and dad and your person who's affected by cancer? If you're younger, are you going to miss out on that sort of loss of being seen with your parents? Are you going to be guilty because you don't want to, you feel angry towards your brother or sister who's got cancer? So there's a lot, it's a whole family impact on cancer, and we need to consider that when we think about our care. I think the other part of cancer that's probably sometimes not recognised and probably not addressed as well is the spiritual care. I think for a teenager and a young adult, they're quite future thinking. They've got goals, they've got plans, they know what they want to do with their life, or they've got an idea of what they might want to try and do with their life. And suddenly facing mortality at that young age can be a huge impact from them. They may not be religious, but I think there's a lot of conversations I've had with young people is about the spirituality and the change and the impact of having cancer on that age. And it makes them think about things that they probably shouldn't and didn't want to think about at such a young age. So I think we need to be mindful, not just the physical and the social side of the impact of young people when they've diagnosed with cancer, but also about their sort of spiritual and if they are religious, the religious aspect of their cancer as well. And that can sort of change into how we approach their care. So I think I've just said, and you guys in the audience are experts in this far more than me, I think there's a threat to the physical side, there's a threat to the emotional side, relationships change, career and education aspects may be impacted on cancer. Your life is put on pause with cancer, I think is a lot of what young people say. And what most young people want is to go back to normal. They want normality. That's something they crave, but it's really difficult for us to sort of supply, if you like, if we're going through working with them. But I think what we've learned in the last few years is how we can actually support young people in a model of care that allows them to have that sense of voice and that sense of place to address some of the issues that we've talked about with a team that will enable them to sort of have an experience of cancer that suits their needs and to achieve their goals if they possibly can. Forgive me, my computer is not happy this morning. So what we've done in the UK and has been replicated in America and Australia and across the world is develop a model of AYA cancer care We know now from literature and from a growing body of evidence that the impact of cancer is wide-ranging. It happens across the cancer trajectory, from diagnosis, or probably even for building up to diagnosis, to the signs of cancer, to building up to across the cancer treatment phase and through to survivorship. And I know you've got a session later this morning on survivorship, but also towards the end of life and palliation. And I think, considering the group that we're talking about today, we need to be very mindful of that. We haven't got as much work and evidence about the end of life and the palliation needs of teenagers and young adults as we probably have with older adults or children. And that's something we need to think about. But also for those people who live with cancer for a number of years, as the young woman who's involved in this presentation is, it's also about how they can, we can take them back through that transition. So our model of care has also got medical things, but it's also got professional, interprofessional and collaboration things to improve the needs of young people. And what's vital to that is a multi-professional team to support them. What the model of care can do is give them specialist care in a wider context of their age range. It can give them security, their own sense of space. And I think particularly important for this age group as they transition through adolescence and young adulthood is individualized, consistent care and connectivity to peers. I think peers are hugely important. I can give a message about a young person about adhering to their cancer treatment, but it's much better if a peer who's been through that experience, knows what it's like, gives them that message. And also it can give them a safe haven for loss of normal life, of future, and then and normality. I'm just going to skip over this slide because I'm just aware of the time. I think the other things is to say life doesn't stop. If you're having conversations with teenagers and young adults, some of these things on these slides will be picked up. And if you're a healthcare professional, you need to be aware that they will throw things at you that you weren't expecting in a conversation. That's part of the joy of working with this group of young people. So when we're talking about a model of care, we're quite often talking about places of care. These are some of them across the world. I think they're fine. If you can afford them, if you can supply them, they're brilliant, but they're not the be all and end all of the model of care. And I think we'll pick that up later with Kira's presentation. I think what matters hugely is the people who give you that care. We very much work to a multidisciplinary team. That's not only doctors and nurses, but also allied healthcare professionals, social workers, particularly mental health workers for this age group, youth support workers or child life specialists, and people who can maintain that normality and keep that young person on the track of their life of what they want to achieve. And also important in that is obviously teachers. So how do we communicate with people? I think the key thing a lot of young people say to me is, I need, how you talk to me matters, and that will help me through my decisions. So we're going to pause now. I'm going to stop sharing my screen, she said optimistically. And we're going to watch a little video from Kira.
Hi, my name's Kira Noble and I'm age 17, and at the age of 11 I was diagnosed with stage 3 neuroblastoma. For the past 6 years I've been in treatment, and as of February 2019 I was told I was incurable but treatable, and since then have been living with cancer. I am a young adult who's gone through many treatments in different hospitals, such as the Royal Hospital for Sick Children in Edinburgh, as well as the Western General, Royal Marsden in Sutton, Glasgow's Children's Hospital, Memorial Sloan Kettering in New York, and Procure Centre in New Jersey. I am now in my 6th relapse with neuroblastoma, and with that I've met many oncologists, doctors and nurses throughout my cancer journeys, and I've always felt like I've been respected and treated like an adult even at age 11, and involved in all decision makings even at such a young age. My primary oncologist is Angela Jasudison, and she is based in the Royal Hospital for Sick Children in Edinburgh. We have a great relationship. My advice to anyone going through cancer treatment is to let your oncologist know the real you and all of you. Angela knows me inside out. She has seen me at my worst, experienced me on my bad news days, and shared in joy when we have our ups. We laugh a lot. I love humour to be included in our meetings. She feels like family to me. She's always been very supportive, and I always feel comfortable around her as well. She's non-judgmental, open-minded, and very receptive to all my ideas. All in all, the relationship between cancer patient and oncologist is just so important and really makes or breaks your cancer journey. I am extremely lucky to be able to get on with mine as well as I do.
So I think what we saw, I also just want to sort of give you time to read this because Kira's mum and Kira asked me to add this to the presentation. So I'll just give you some time to do this. Okay. So I think what we saw in Kira's presentation and video is she's lived with cancer throughout her adolescence. She's had multiple surgeries, multiple decisions to make. But I think, as we know with neuroblastoma, it's now increasingly a long-term condition, but also a national and an international treatment process. So Kira's been through multiple teams, had to build multiple relationships with different healthcare professionals. And many of those healthcare professionals have been in different cultures to herself. She's from Scotland, she's been to England, but she's also been to the States. We all work differently, we all have different perspectives for how we treat young people. And she's also been through a huge transition. Not only she's matured from a young child into a young woman, but also through her treatment process and what neuroblastoma means to her. I think she's also shown very clearly, and if you go onto her website, Facebook, you'll see that she's a very articulate person. She's expert in her care. She recognizes what she wants to do, and she's been able to make the decisions with people, with her team, with a lead consultant to ensure that she is able to continue her life and to achieve her goals while living with incurable but treatable cancer. So how can we replicate what Kira's experienced working with Angela and with her team in the UK and across the world? I think if you're going to, I think the key thing that was recognized in that is the relationship. If you're going to build a relationship with a teenager and young adult, one of the top tips I would say is be yourself. They know when you're faking it, and they will very quickly tell you if you're faking it, and the conversation will end quite quickly if they think you're faking it. So be yourself, focus on them, switch your phone off. And I think Kira very clearly said that she was treated with respect and listened to. And those are the key things that they want in any relationship we have with our young people while we're working with them. This may take time. You've got to get to know the young person. They've got to get to know you and to build up trust. So it may be a multi-layered approach. And I clearly recognize in some situations that's not possible. But if you can, take your time, get to know them, share a little bit about yourself so they get to know you, and then just work with it and enjoy the journey. I think if you've got a significant, and we would all do this, I'm sure, but if you've got a significant piece of news, you need to take your time to plan your approach. And I think this also goes back to the whole family system. You're working in a relationship not only with a young person, but with their parent or carer, but also within their social context. If you have time and the young person wishes to do it, I would offer the young person time alone so they can share their experiences, answer their questions, give you their opinion. That might be some challenging for some mums and dads because they're normally with children, obviously they're in all the time, but I think for young people that time or that offer of time alone is quite important, and again continues that journey of independence and allowing them to make decisions. I think, again, the other thing to remember is that swinging between emotional and decision-making in a clarity point of view. Ward rounds are intimidating, groups of people are intimidating to these young people. They're not practiced in sharing their experiences with an audience. So I think if you're doing a ward round, think about how many people you take into that room, how many people are with you in that situation. It's about giving the time and the space for the young person to be part of their care. And I appreciate a lot of this is now happening online, which brings its own challenges, or with face masks, which again brings another challenge. I think there's a lot of things that we've talked about the normal things about how you give news and how you take time to decisions. It's pacing it, it's allowing them to share their thoughts, it's recognizing they may change their minds. You may think you've reached a decision, but they may go away and think about something else that you haven't thought about, or they may change their decisions. There may be conflict in decisions, what parents want to do, what you want to do, what the young person wants to do might not align, and those alignments will shift over the time. So be prepared. I think the consistency is key here. Sharing it through text messages, through written, through email. I know that's a pain at times, but again, it's just that consistency, that space, that time, and then allowing them times to express their emotions. They will do. I've had a young guy who I was giving in a consultation with, who was being given some difficult news, and he was on his phone buying trainers. The consultant got quite cross with that because he didn't think that young person was listening to. He was listening to it, but what was important to him at that moment in time was getting his trainers at a good price. Once he bought his trainers on eBay, he then rejoined the conversation. That's just how you're going to have to go. So it is about that consistency and working at their pace and recognizing that journey might happen, and you might need multiple conversations with the people that's in that relationship with that young person. I'm sure Mr. Trump looks like this morning. And I think the challenge of body language, that young guy was obviously representing some body language that was difficult for that consultant, but also our body language, particularly when we're on Zoom, needs to be moderated. And I think that's important to recognize their shift of body language, but also our shift of body language. I think if you're discussing options, again, it's laying out what represents to them, giving them the facts at a slow and steady pace. Your perception of what's right might not be their perception of what's right. Give them the full picture before you set out, and then go back to what you want to achieve. Take time to do that, listen to them, and be prepared for the changes that I've sort of talked about before. And I think Kira really recognized that and has really demonstrated that she obviously seems to have had that relationship with Angela and the teams that she's had. She had a goal, she had a plan, she wanted to live a life as a normal adolescent. She took decisions that I think her mum, and if the video of her mum said that was quite scary to step back and let her take that decision. But she recognized that she needed to do that as part of that transition of Kira's care. She needed to be that scaffolding, to be there when she needed to be there for her, but also take time and allow Kira to actually take the decision on her own. So I think Kira's video, although it was short, gave such a lot of insight for us as to how we can work with teenagers and young adults. Just let them be, let them enjoy it, take your time, go with them, don't fight against them, but be prepared, as I said, to have more than one conversation and for the journey to change. I think it's a pleasure working with young adults, I think, and teenagers. We need to be experts in our care. You need good communication skills. You need to be not judgmental. You need to be not easily shocked. They will do things that will make you smile, but make you think, wow, I would never have thought of doing that. And I think Kira's demonstrated that in her video and in her slide that I showed before. You do need a good sense of humor. You also need to be patient and thick-skinned. They will throw things back at you that you weren't expecting. I'm not sure that Kira did that, but I've certainly experienced that with working with young people. And they do get angry, and you have to survive that wave. Sue Morgan, who's a sort of nurse guru for teenagers and young adults, says, well, if you work with teenagers and young adults, you're wise and we guide. But we just guide, we let them lead. So the last slide is from Kira's mum, and I'll give you a minute to read that. So thank you for listening. Thank you for the clinicians, and also for Kira for sharing her story and talking to me, and for her mum for talking to me and sharing their story as a family. They're a very tight unit. They're a great team. And I hope she continues to continue her journey as she is at the moment. So thank you so much.
Okay. Thank you. So we do have a couple of questions, and I have a few as well that I might get to if we have some time. So, first of all, so there's a sort of statement that comes with this. It says the most important thing is that young people affected by cancer know where to go for the right support. My question is related to friendship, peer support networks. So what support is available to help them, the friendship and peer support network, that is, help better understand what their friend or sibling is going through, so that, and then it finishes with, so that the person affected isn't always the one trying to explain.
I think this is where social media comes in, and obviously the age group that we're talking about are social media natives. They use it very well. I think there's two things there. There's their own social media. We've advised, a lot of young people set up WhatsApp groups, Facebook groups. That's probably my level. I'm sure there's much more trendier groups than that. And so what I think a lot of people get a lot of text saying, how are you? What's happening? La, la, la. And I think that puts a lot of pressure on a young person, probably parents as well. I think what young people have done, who I've worked with, have just put posts up and given them that information on the post. But I think what young people are looking for is that sense of normality. And in some ways, young people who we're working with at the moment have said COVID has helped that, because everybody's in isolation. So nobody can meet. So I think that everybody's on Zoom, everybody's on TikTok, everybody's on WhatsApp, has enabled some young people to say they're better connected to their friends than they were pre-COVID. Other charities, ourselves, Canteen and Teenage Cancer America, have Facebook groups, social network groups, where peers can sort of meet and support each other there. So I think it's making sure that people have got the information they need, so they don't always come to the young person or the mum and dad for support or information, but also enabling to have that normal social connection. Does that answer your question, or is there more I could?
No, I think, yeah, that makes sense. Thank you. So another question, similar in nature, because it focuses on siblings. We know that the siblings of young people with cancer can often feel isolated themselves. Yeah. How can we ensure to incorporate their needs in our thinking when considering and planning our support for young people?
I think it goes back to that whole family thing, and I think it can be a challenge. And I think what we're hearing at the moment is, certainly for the young adults, and probably for younger families as well. Previously, when we were all allowed to get together and meet face to face, you've got a relationship with that family. So you could actually work with social workers who might want to meet and support siblings or parents. And that's quite difficult to sort of get that sort of wraparound care that young people have now because of COVID. But in non-COVID times, and we will go back to them, I think it's recognizing, as I said, the impact that cancer has on the whole family, and recognizing that just as people who are affected by cancer need to meet peers, then siblings need to meet peers. They need to have that relationship with other people who have gone through their similar experience from their perspective as a sibling. And a lot of charities I know do run sibling support groups, sibling Facebook groups, things like that. But I think it's also just allowing parents time to go and be with the other children if they can. It's also allowing free visiting, allowing siblings to be part of the group. But I think it's an area that, 20, 30 years I've been doing this, we've always been to be aware of what the support that siblings need. I think it has to be personalised to the age and stage of that person. We probably still haven't got it quite right. I think it's work that we still need to do more of.
Thank you. So different type of question, this one. How would you respond to a parent and teenager not being in agreement regarding treatment?
So this has happened quite often. It is from your communication style as a healthcare professional, it is about that negotiation. I think it's giving both parties time to speak alone, to enable them to share their thoughts and put their perspective across. I think it's then about bringing people together to discuss that. And I think I have met some young people who have made very different decisions from their parents. I think there's the age of majority. If you're 18 in the UK, then your decision as an adult is your decision, and if you've got capacity to make that, then we will go with the young adult. And also teenagers are able to make their decisions. It goes back to all those sort of things that I did about the communication. It's meeting people, it's setting goals, it's having repeated conversations. And sadly, the situation in some cases wasn't resolved. In most cases, it is resolved, but again, it takes that time and space, that expert in the room. You may need to bring other experts into the room to sort of put that point across. You might need advocacy for the young person. It is a journey with the family to do that. As I said, in most cases it's resolved, some cases it's not resolved.
Okay. Thank you. So another question, Jessica. So what are your thoughts around the transition of care from pediatrics to adult care follow-up for adolescents and young adults? When and how does this happen successfully for the adolescent, young adult and family?
I think that's a really good question. I think I might know who asked it. I think it has to be made clear at the start or at the beginning of the young person's cancer diagnosis, not obviously in the first conversations, but I think people have to know. It's a bit like school. You know when you're going to leave school. You know you're going to move from primary school to high school. And I think that same sort of conversation should take place when you're beginning your care in a children's setting, that there is a boundary when you'll be moved to adult care. I think it's about starting that transition early. It's about building it. Again, it goes back to the conversation about communication. It's about getting bits of information in a pace and an amount that's right for that young person and that family to understand why they're moving, where they're moving to, but also to meet the team that they're moving to and the place they're moving to. So again, the analogy is moving from primary school to secondary school. There's a very good set transition for that. But also going with that person on that initial stage of that transition. So you don't just hand somebody over and that's your relationship ended as a healthcare professional in children's care. You pull away, again, it goes back to scaffolding. You take that young person into the adult setting and then you pull away at an appropriate pace and hand that transition over once that young person and family have built relationships in the adult cancer. So it's a journey, it's not an event.
Okay, thank you. So a question that I had in one of yesterday's sessions, we heard about young people being able to sort of see the wider picture more than their peers would. A young person going through cancer treatment rather will be able to see the wider picture and look ahead more than sort of their peers might. And I was wondering whether sort of that is consistent in adolescent and young adults, or actually whether they might actually narrow their views as they are going through these changes.
I think it's two things. I think it goes back to the spirituality. They are faced with an event in their lives which is rare, which is life-changing, and I think they at times do zoom out and look at the future, what might happen, what can happen. And I think, as Kira's described, can then zoom back into the details and the process and the decisions that enable them to do that. So it depends what's going on with the treatment, how you're feeling that day. So yeah, there are times when they will zoom out and look at the wider picture. and from a different perspective from their friends, because their friends are unlikely to have had a similar experience. And that's where I think meeting with peers is important, because if you're going to have those thoughts and those conversations about the future, what it looks like, how it will be different from your cancer experience, you can have that with somebody who recognizes that experience. It's a much richer and a much deeper conversation. But likewise, you may want to have that conversation with your mum or your dad, or somebody else, or somebody completely independent. Young adults and adolescents are quite protective of their parents. And if they are having those sort of wider spiritual type conversations, they might not want to have that with their mum and dad because they might not want to upset them. So they may choose to have another person to do that. And that's what we try and do with the sort of TYA cancer team, is enable that there's a team where young people can speak to and have those conversations. So I think, to answer your question, I think they do zoom out and have a sort of wider perspective of life, but sometimes they need to zoom back in, focus on the details of the here and now, because that's how they're feeling, or work through some thoughts and feelings with some people, or to work with somebody to actually how they're going to achieve those goals, whether they're immediate goals or goals in the long term.
Great, thank you. So we have one more question. We do have time for one more. So Kira clearly has so much to offer to others going through similar journeys, importantly, hope, passion, and confidence. In your experience, how likely are young people to want to get involved in informing future treatment options and care, or is that just too much to expect?
That's a great question. When I was in clinical practice and also coming into the third sector, I think some young people are very, very keen to have a voice, to give something back, and also to enable not only psychosocial developments in TYA cancer care, but also clinical trials, how they're going to run, availability of early phase trials. So they are, and also changing policy. So I think young people are very, very, if they wish to, can be involved and want to be involved. And I think, again, it's working with that young person and finding out where they want to be in that role and where they want to give back. I think most clinical research trials would have, if they're building, would have a public and patient involvement process. Policy does, certainly service development does. We have a youth advisory group, as do both charities. And I know Kira is an ambassador for many charities. And I think, yeah, if they want to do that, then we should afford them the opportunity to be participants in their care.
Thank you. So yeah, thank you again, Dr. Louise Soanes. And thank you for a really, really interesting presentation. Also, thank you to Kira and her mum for sharing some of Kira's experiences. Thank you to everyone watching and for your questions. We have reached the end of this session now, but after the break, we have transitioning to adulthood and molecular radiotherapy for neuroblastoma running concurrently. Remember, if you miss a session, it will be available to watch shortly after the live session ends on the on-demand page of the event website. Thank you.